Hello everybody, how we doing? Welcome to my YouTube channel once again. I'm Dr. Elemile, a family physician. Please click the subscribe button to subscribe to this YouTube channel, and also click on the notification bell to alert you when I drop new videos. Thank you for tuning in today once again. Thank you so much. I do appreciate it. Today I'll be discussing something that's topical. I'm going to be discussing vaccines, vaccination, and immunization. Given the controversies around the COVID-19 vaccines, I felt it's necessary to enlighten the public on how vaccines work and to debunk some of the conspiracy theories out there. So the environment, our environment is filled with germs. Germs are microscopic organisms that we cannot see with our naked eyes. And the disease-causing ones are called pathogens. Pathogens are disease-causing organisms. Now, these pathogens can come in form of bacteria. Example, your typhoid, Salmonella typhi that causes typhoid fever, Mycobacterium tuberculosis that causes tuberculosis. And also, they can be viruses, for example, SARS-CoV-2 that causes COVID-19. There are different types of coronaviruses, but the one causing COVID-19 is called SARS-CoV-2. Another example of a virus is human immunodeficiency virus, HIV virus, HIV. Other pathogenic organisms include protozoa, and an example of that is Plasmodium species. There are different species of Plasmodium that causes malaria, and the last is fungi. And a common example of such is Candida yeast infections. Now, the natural response of the body to a pathogenic organism is such that when a pathogenic organism is introduced into a system, the body wants to defend itself by way of fighting, producing soldiers, what I call in simple terms, soldiers to fight or ward off the infection. In fact, there are physical barriers in our body that helps to fight against infection, the likes of the skin, the likes of the mucous membrane, the likes of cilia, which is a microscopic hair-like structure that helps to ward off pathogens. Now, pathogens, irrespective of the type, they have different subunits. They are made up of different parts, and the parts that can elicit an immune response is called an antigen. When such an antigen is introduced into the body recognizes it and produces fighters. The name of the fighters or soldiers, the name of the soldiers are called antibodies. The body produces antibodies to fight against to attack the antigen. Now, there are specific antigens to a specific disease-causing organism, and they're specific to the disease that they cause. Well, having said that, sometimes antigens can look alike. They can look like cousins, and then an antibody produced against one antigen can also help with another antigen of another organism. But that rarely does happen. But as a rule of thumb, antibodies are specific to a particular antigen. Now, when an antigen is introduced, as I said earlier, when an antigen is introduced into our bodies, the body mounts an immune response against this by producing fighters. We have the first, we have the first, what I want to call the first responders, of primary responders, or primary soldiers. That's when an antigen is introduced to the body for the first time ever. It takes some time for the body to produce fighters or soldiers that will attack the antigen. It takes some time. And after the primary response, there's some cells which we call the memory cells. After the infection might have been being dealt with, the memory cells are produced to recognize the antigen at another time when it is introduced to the system. Which brings me to what we call the secondary soldiers. The secondary soldiers are recruited when the body is introduced to an antigen the body has seen before, so that the response is faster, the attack is faster, and it's not likely that someone will come down with an illness at that time. Now, in a nutshell, what I've tried to describe is that there's a different response when a body sees a pathogen for the first time. And at subsequent times, the response is also different. So if a body sees a pathogen for the first time, which is called the primary exposure, the body, it takes a longer time to recruit soldiers to fight that infection. In fact, the person can come down with an infection, but the overall immunization can take place, but it takes a longer time. But after that primary exposure, the body produces what we call memory cells that remembers the antigen even after the infection might have been dealt with for subsequent times. So when the body sees that pathogen again at a subsequent time, the body recognizes it faster, produces soldiers faster that attack the antigen, such that the person does not come down with the illness.